Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician. We are revising homeopathic remedy Cactus Grandiflorus, and this is part 7, clinical correlation. The text is from Allen's keynote, and this study is very good for BHMS students and interns. So let us go to the first PQR, sanguineous congestions in persons of plethoric habit. This is a constitutional component of PQR1 and often resulting in hemorrhages. Sanguineous apoplexy is the diathesis part. A constitution, physical constitution having physical attributes and direct relationship with the disease pathology that has been correlated in this opening dialogue of Allen's keynote. This is the probable approximate pictorial representation we can have about sanguineous congestion in persons of plethoric habit. So let us recap. The constitutional somatic features point to a bodily condition characterized by excess of blood and marked by florid complexion. If you translate clinically the above features, you may find such constitutional features are seen in cases of Cushing syndrome and maybe polycythemia vera. And such people are prone for apoplexy. Cerebrovascular accident, especially hemorrhages. And the most common reason is hypertension. You will find hypertensive hemorrhage as seen in this particular diagram. They are in the subcortical region. Thalamic hemorrhage, this is in the subcortical region specifically, which is corresponding to collection of gray matter, which is thalamus, caudate nucleus and lentiform nucleus. They are known as subcortical nuclei, and they are supplied by the end arteries directly, which are coming from middle cerebral or anterior cerebral or posterior cerebral artery. So the damage is extensive because this is a highly compact area through which the fibers of internal capsule are traveling. So whether it is a ascending tract or descending tract, both of them, they will be affected even if the bleeding is pinpoint and they have a very wide area of functional loss. These people are predisposed to cerebrovascular accidents, which previously in homeopathic literature we find a very common term as apoplexy. Friends, let us go to PQR2, fear of death, believes disease is incurable. Similar symptom we find in case of arsenic also. So this is a kind of facial expression. The patient is afraid and depressed also. Let us recap. The cactus patients are having coronary artery disease, which we can understand the symptomatology of cactus corresponds to angina pectoris, may be stable or unstable angina, and they have a belief that the disease is incurable, and to some extent they are correct also. With cardiac pain, they may have fear of death and they can go into the acute panic attack. Clinical correlation is, however, cactus have a melancholic temperament type. Therefore, fear is a component of the clinical diagnosis of depression. When it becomes very severe, it is known as melancholic depression. Fear of death is one of the most common types of universal fear which we harbor, we human beings harbor. Friends, we go to the PQR3, hemorrhages from nose, lung, stomach, rectum, bladder, and we have some of the important corresponding remedies: Crotalus, millefolium, phosphorus. This tells us about the diathesis part, predisposition, genetic predisposition or intrinsic predisposition to the patients who belong to Cactus Gradiflorus. So they have epistaxis. This is a very important diagram which shows the Castleback's plexus, where networks of arteries in front nasal cavity are communicating with each other, and in case of hypertension, especially the people who are middle age group, they have sudden bleeding because it acts like a valve, and at one particular high level of blood pressure these arteries break open and it acts as a safety valve where the bleeding takes place, and as we lose blood, ultimately which lowers the blood pressure and it stops. Maybe the bleeding can be voluminous, people are afraid looking at the blood, but if it could not happen this way, chances are there that they may have the intracranial hemorrhage. So bleeding from the nose, lungs, stomach, anywhere, if it is in case of hypertension, that is a protective mechanism we have. Clinical correlation: Cactus has hyperemia and congestion. Active hyperemia is due to increased arterial blood inflow, and which is commonly seen, for example, in hypertension, which leads to such episodes like epistaxis. And then we have passive congestion of hyperemia, where we have diminished venous return. For example, we have congestive cardiac failure, systemic and local congestion by dilatation of the small venules or vessels take place, edema takes place, pedal edema, and there can be hemorrhage also. PQR4 is telling us about headache, pressing like a heavy weight on vertex. Better by pressure is Menianthus. Climacteric period we have Glonine and Lachesis. So let us see what it tells us about. Simultaneously we will take over PQR5 also, headache and neuralgia, congestive, periodic, right-sided, severe throbbing, pulsating pains. So this is a particular general. We are talking about head area, and symptoms are there because of there is arterial congestion and which causes a throbbing kind of headache or pulsating headache. So pulsating headache is very common feature which we see in case of migraine. A headache on the right side of the head is caused by migraine. Commonly, right side or left side unilateral headache is commonly because of migraine. Sometimes you will find tension headache or cluster headache also, and trigeminal neuralgia if it is belonging to ophthalmic division, or sometimes there is a referred pain phenomena from the teeth that can be present unilaterally in the temporal area. Clinical correlation we have: females nearing menopause are predisposed to migraine, and we know that migraine is a vascular headache which is caused by over-dilatation of the blood vessels, stress, long hours of hunger, high blood pressure. All these act as contributing factors for headache. Friends, we go to PQR6 and it tells us about whole body feels as if caged, each wire being twisted tighter and tighter. PQR7 also has the same theme: constriction of throat, chest, heart, bladder, rectum, uterus, vagina, often caused or brought on by the slightest contact. This is a physical general. It involves the whole body. So let us recap. It is a visceral hypersensitivity which we can understand these symptoms. Whenever we have any kind of stress, there can be environmental factors or intrinsic factors, or there could be some psychological conflict, and that results in subconscious stress which ultimately reacts our voluntary and involuntary muscles, and they go into the spasm. If these muscles go into the spasm, especially the visceral part, you will find all these sensations which are being explained in PQR6 and PQR7. So we can understand that these sensations are especially due to constriction of involuntary muscles which are present in the intestines, blood vessels, common bile duct, ureter, uterus, urethra. Clinical correlation we have: involuntary muscle is a muscle that contracts without conscious control. It is not under your willpower to control them or relax them. The smooth muscles, they are involuntary. As we remember, they are found lining the internal organs such as the esophagus, stomach, intestine, uterus, vagina, bladder, ureter, and blood vessels. The cardiac muscles are also involuntary muscles. PQR8, operation of the chest as from a great weight, as if an iron band prevented normal motion. And PQR9 tells us that sensation of a cord tightly tied around lower part of chest, marking the attachment of diaphragm. At the point of diaphragmatic attachment, that is where the patient feels great stress or pain or constriction in the chest. So let us recap. The very common condition where you find the chest muscles, involuntary muscles, intercostal muscles and diaphragm, which can come under stress because of bronchial asthma. Whenever there is bronchioles are there, they are constricted, and then the patient cannot breathe normally. Inspiratory phase is prolonged, expiratory phase may be short, but expiratory phase is prolonged, and repeated inspiration and expiration causes exhaustion of these particular muscles, and they are tense and they become stiff, giving this kind of a feeling in the chest, feeling of weight. Clinically, features point to severe cases of asthma. Patient develops chest tightness when the airways are so narrow, it is difficult to get the air in and out. This makes them feel like there is a heavy weight on their chest. This sensation is due to a strain and a spasm of intercostal as well as diaphragm. Let us go to the PQR10. Heart feels as if clasped and unclasped rapidly by an iron hand, as if bound, had no room to beat. And this typical sensation belongs to cactus. And we know that, let us recall, angina pectoris occurs when the heart is not getting enough blood supply. Patients with coronary artery disease are at greater risk of angina pectoris, and other risk factors include obesity, uncontrolled diabetes, alcohol intake, smoking, and physical inactivity. Sedentary lifestyle. Clinical correlation, we have to recall about types of angina. We have stable angina, where we find angina pectoris occurs when a patient is involved in some kind of physical activity like exercise. During physical activity, the heart becomes overactive and needs more blood supply, which is not getting over there because of atherosclerosis, and which results in angina pectoris. Unstable angina is much more serious, and here the pain occurs anytime, even when the person is resting. Unstable angina can get worse over time, and it will ultimately result in MI, myocardial infarction. PQR11 points everywhere darting, springing like chain lightning, and ending with a sharp, vise-like grip only to be again renewed. These features point to psychogenic pain, and most commonly you will find that some physical exertion or stimulus will aggravate this kind of pain, which can be acute or chronic. Clinically, we find acute pain is something which is sharp but brief and usually do not require any kind of management or treatment. However, in chronic pain, which is persistent, lasting anywhere from a few weeks to several years, so chronic psychogenic pain can be felt all over the body with varying intensity, though it most commonly present as a headache, muscle ache, abdominal pain, or backache. Friends, we go to the PQR12. Menstrual flow ceases when lying down. We have similar remedies, Bovista and Causticum. Let us recall, feature point to effect of gravity. That is the most probable explanation we have in this particular case. It might seem like the period stops while lying down. However, it can be due to gravity at work. When the girl is standing up, the gravity helps blood flow out of vagina. But if she is lying down, blood doesn't flow out of vagina so easily or uterus so easily, and especially if the flow is lighter. PQR13 tells us about palpitations. Day and night, worse when walking and lying on left side like legacies at approach of menses. Palpitation is an unpleasant awareness of the abnormal heart beating. Recap. This is the menstrual cycle. We have estrogen phase and progesterone phase, and you will find in the mid of the period on the 14th day luteinizing hormone and ovulation takes place. So with these particular hormones at work, you will find cardiac palpitation during menstrual cycle, which mostly occurs during the luteal phase, when the estrogen levels are low and progesterone levels are high. The decreased estrogen level and increased progesterone level can cause palpitation. PQR 14, we find fever paroxysm returning at 11 am and 11 pm. Clinical correlation is within 24 hours. If the febrile paroxysm returns more than once, the most common cause could be pyemia. The time modality in case of Cactus grandiflorus is characteristic symptom of this remedy. Thank you friends for your patient listening.